everyone, so let's move towards our today's topic, which is...
Before starting this topic, I would like to tell you something, and as you already know, but remember this point once again, that heart consists of four chambers: right atrium, right ventricle, left ventricle, and between the atria and ventricle there is an opening called atrioventricular orifice, which is guarded by bicuspid and tricuspid valve, and from ventricle to from right ventricle, the blood will pump into the pulmonary circulation through pulmonary trunk, and the valve in the pulmonary trunk is semilunar valve, and the valve in the aortic artery and aortic aorta, which is arising from the left ventricle, consists of valve that is also known as semilunar valve. So remember these points. And one more thing which is very important, that the whole our heart will contract and relax due to SA node, that is sinoatrial node, and AV node, that is atrioventricular node. Okay, from these the pulse, the nerve impulses, the electrical impulses will generate, and due to which the contraction will occur. We will discuss in the next recording, and we have already discussed. You can listen that recording as well. But in this recording, we are talking about cardiac cycle, what happens inside the heart during contraction and relaxation. So there are four phases. Before that, you have to remember one more thing, that is diastole. What is diastole? Diastole is the relaxing state, and systole is the contracting state. During systole, blood will pump, and during diastole, blood fills in the atria or ventricular. One more thing, during diastole, pressure will decrease, and during systole, the pressure will increase. Okay, now what is cardiac cycle? Cardiac cycle is basically the time duration, time period, or the event from the beginning of one heartbeat till the beginning of another heartbeat. Okay, that is called as cardiac cycle. What happens in that one, what happened during that one beat, one heartbeat, what happened? That is basically cardiac cycle. Okay, now normal heartbeat is 72 per minute, and if we talk in seconds, one beat will take place in 0.83 seconds. Now moving towards the steps. Number one step, and the most important step, is the filling of the atria. Okay, when the atria fill with the blood, obviously then it can pump into the ventricle. So when the atria are in diastole, okay, atrial diastole, the blood from the if we talk about right atrium, from the vena cava, and if we talk about left atrium, pulmonary veins, the blood will enter into the atria. When there is atrial diastole, the valves, the atrioventricular valves, are basically closed. That is the reason the atria can fill the blood into its chamber, okay, into its capacity, into its area. And during the atrial diastole, the ventricle will contract. And why they are contracting? To pump the blood into the pulmonary circulation and systemic circulation. Okay? Now moving towards further, as soon as the atria fill with the blood from the vena cava and pulmonary veins, the ventricle, now the second step is isovolumeric contraction. Okay, in this step, in this phase, the muscles or the ventricles, or the muscles of the ventricle will be relaxed. Okay, and after 0.02 or 0.03 second, the valve of the tricuspid or bicuspid valve will be open. Okay, due to this valve, the atrial contraction will occur, and blood will pump into the ventricle. But here is the main concept which you have to memorize, that is, when the blood from the atria enter into the ventricle, it is due to gravity as well as due to contraction, because what happened when the ventricle relax, that is ventricular diastole हुई, bicuspid and tricuspid valve open होंगे, ठीक है. एट्रियल कॉन्ट्रैक्शन होनी है, बट एट्रियल कॉन्ट्रैक्शन होने से पहले ड्यू टू ग्रेविटी, क्योंकि एट्रिया ऊपर है वेंट्रिकल नीचे है, तो ड्यू टू ग्रेविटी फ्रॉम द एट्रिया टू द वेंट्रिकल 80% of the atrial blood will flow from atria to ventricle within few milliseconds. Okay? Then the remaining 20% blood will be pumped into the ventricle due to atrial contraction. That means, if I explain further, पहले ventricle relax होते हैं, valve open होती हैं, atrial blood 80% atrial blood without contraction ventricle में जाता है through atrioventricular orifice. Okay, because the eyes are open now, and the 20%, the remaining 20% blood from the atria will be pumped into the ventricle due to atrial contraction. Now, as soon as the ventricle get blood with full blood, that means the pressure in the ventricle will increase. As soon as the ventricular pressure increase than aortic pressure or pulmonary pressure, it can cause contraction. How? Aortic pressure is the normal aortic pressure is the normal pressure in the aorta is basically 80 mm, and the normal pressure in the pulmonary trunk is 8 mm. Okay, so in right ventricle, when the pressure increases from the increases till above 8 mm, and in the left ventricle the pressure will increase more than 20 mm, more than 80 mm, then we can say that ventricular pressure is more than aortal pressure or pulmonary pressure. Then the ventricular contraction will occur. Okay, so basically now the next step is ejection period. This is known as ejection period. So ventricular pressure is increasing and the atrioventricular orifice will be closed, and due to pressure, not due to papillary muscle or chordae tendineae, due to ventricular pressure, due to rise in ventricular pressure, the semilunar valve which are present in the aorta and pulmonary trunk will be open, and the blood and the ventricles will contract, due to which the blood will pump into the aorta and pulmonary trunk. So basically you have to remember these things as well, that normal aorta, the normal pressure in the aorta is 80 mm. When the left ventricle increase their pressure more than the pressure in the ventricle is more than 80, then the semilunar valve of the aorta will open and the blood will be pumped out into the aorta and the systemic circulation. Same as it is in right ventricle. When the pressure in the right ventricle will be increased more than 8 mm, the semilunar valve in the pulmonary trunk will open, and due to which the blood which is present in the right ventricle will be pumped into the pulmonary circulation. But like we know that when we are breathing normally, okay, or during exercise, during heavy exercise, there is an increased capacity of taking in and taking out of the air, that is inspiration and expiration. But there is some volume of air which remains in the air, and that volume is known as residual volume. Same like that, in heart, when the ventricles will pump the blood into the pulmonary or systemic circulation, there will be there will be a small amount of blood which will be remain in the ventricle. Okay, and after that there is a fourth step which is known as volumic relaxation, which causes the semilunar valve to close, and for 0.03 second the ventricles will be relaxed completely, and this is the duration in which both the valves, that is atrioventricular valve and aorta, that is semilunar valve, these both valves are closed during ventricular relaxation. Okay, and as soon as the ventricle relax, the cardiac cycle starts again, that is atrioventricular orifice will open, and from the atria 80% blood will enter due to the gravity into the ventricle, and so on. Okay, now remember few terms as well and few beat sounds as well. As soon remember one thing, the valve which are opening is the opening of the valve is basically a slow process, but when they close they produce a sound. Okay, when the atrioventricular valve will close, they produce a sound. They produce first heart sound, that is love sound, and when the semilunar valve will close, it produces second beat sound, that is dub sound. Another thing regarding this is, what is end diastolic volume, what is end systolic volume. End diastolic volume is something when the ventricles, or when during the diastole condition, if the blood volume will increase, that volume, that increase amount, or that net volume of the blood in diastolic condition which is increasing, is known as end diastolic volume. And what is end systolic volume? After the contraction, the blood, like I said, after contraction the blood will remain in the ventricle, and approximately there is a 40 to 50 millimeter blood which remain in the ventricle. And it doesn't mean that it remain in the blood forever. No, it remains in the blood and will be pumped out in the next cycle. ठीक है, जब नेक्स्ट साइकिल होगी तो ये वाला ब्लड पम्प्ड आउट हो जाएगा, और कुछ और जो नया ब्लड आया होगा वो थोड़ी देर स्टे करेगा वेंट्रिकल्स में. ओके, एंड व्हाट इज स्ट्रोक वॉल्यूम? स्ट्रोक वॉल्यूम इज द वॉल्यूम पर बीट that is pumped by ventricle in every beat. It is known as stroke volume, and that the amount of the stroke volume is 70 millimeter. Okay, so the stroke volume, the amount of stroke volume is 70 milliliter, not millimeter, milliliter. Now once again I am giving a recap or overview of the cardiac cycle so that you can understand it properly. Number 1 step was एट्रिया की फिलिंग हो रही है, देन एट्रिया से ब्लड वेंट्रिकल में जा रहा है 80% कॉन्ट्रैक्शन से पहले एंड 20% ब्लड कॉन्ट्रैक्शन की वजह से वेंट्रिकल में जा रहा है. ओके, देन द सेकेंड स्टेप वॉज आइसोवॉल्यूमेट्रिक कॉन्ट्रैक्शन. आइसोवॉल्यूमेट्रिक कॉन्ट्रैक्शन क्यों हुई? बिकॉज ऑफ आइसोमेट्रिक कॉन्ट्रैक्शन मीन्स, आइसोमेट्रिक मीन्स आइसो मीन्स सेम एंड मेट्रिक मीन्स वॉल्यूम. ठीक है, आप ये भी कह सकते हैं आइसो वॉल्यूमिक कॉन्ट्रैक्शन और आइसोमेट्रिक कॉन्ट्रैक्शन बोथ आर सेम. ठीक है, तो वॉल्यूम विल रिमेन सेम एंड वेंट्रिकल विल स्टार्ट कॉन्ट्रैक्टिंग. ओके, ड्यू टू दिस कॉन्ट्रैक्शन द AV valve which are open because of filling of the ventricle, now due to this contraction, this little or initial contraction, that valve will be closed, and as soon as the pressure inside the ventricle will increase, like I said before के right pulmonary trunk में 8 mm होता है. अगर वो right ventricle में 8 mm से बढ़ गया और left ventricle में 80 mm से बढ़ गया pressure, देन सेमिलुनर वेल्व ओपन होंगे और इजेक्शन फेज होगा। इजेक्शन फेज में क्या होता है? इजेक्शन फेज में वेंट्रिकल से ब्लड बाहर पंप आउट होता है एंड देन फिर जब प्रेशर नॉर्मल हो जाता है, वेंट्रिकल में दोबारा कम हो जाता है, देन सेमिलुनर वेल्व क्लोज हो जाते हैं एंड वापस आइसोवॉल्यूमेट्रिक रिलैक्सेशन होती है, क्योंकि वेंट्रिकल कॉन्ट्रैक्ट हुए होते हैं पंपिंग के लिए, देन वो रिलैक्स होते हैं एंड ड्यूरिंग आइसोवॉल्यूमेट्रिक रिलैक्सेशन फेज, रिमेंबर दिस पॉइंट, बोथ द वेल्व दैट इज एट्रियोवेंट्रिकुलर वेल्व एंड सेमिलुनर वेल्व बोथ आर क्लोज। ठीक है, जब वो रिलैक्स हो जाएंगे देन फिर दोबारा वही साइकिल शुरू होगा कि एवी वेल्व खुले, ब्लड फिल हुआ वेंट्रिकल में, देन ठीक है। तो हम जो कार्डियक साइकिल पढ़ते हैं वो बेसिकली हम पढ़ते हैं वेंट्रिकल के अकॉर्डिंग, दैट इज आइसोवॉल्यूमेट्रिक कॉन्ट्रैक्शन, देन इजेक्शन पीरियड, देन आइसोवॉल्यूमेट्रिक रिलैक्सेशन। लेकिन उससे पहले का क्या स्टेप्स है? स्टेप्स हैं कि एट्रिया में फिलिंग होती है, देन एट्रिया से वेंट्रिकल में ब्लड आता है, वो आपको याद रखना ज़रूरी है जो मैंने पहले बताया। ओके, सो दैट्स इट फॉर दिस टॉपिक। So guys, take care of yourself and study hard, work hard, and good luck. Bye.